morning. Are you Alina Arellano? Yes, I am. Hi, my name is Julie Johnson Higit. I am your student nurse for today. Please take a seat. I'm just gonna lock the door before we start. Today, we're gonna measure your blood pressure. This is done to obtain a baseline measurement, your arterial blood pressure, and to determine your hemodynamic status. Have you ever done this before? No. Okay, so before we start, excuse me, I'm just going to wash my hand and prepare the needed equipment. Oh, hi again. So, before we start, please sit straight and cross your legs and put both of your arms on the side. So, which arm do you prefer to use? The right arm. Okay, so how do you feel right now? I'm okay. So, okay then, please take a few breaths before we start.
First, feel the client's brachial artery. After knowing where it was, place the cuff at least 1.5 to 2 inches above the pulse. The arrow in the cuffs serves as a pattern, so it needs to be positioned on where the artery is. To know if the cuff perfectly fit the client, put 2 fingers inside. It shouldn't be too snug or too loose. Put the sphygmomanometer somewhere you can still see. After putting the cuff, close the valve so the air won't go out. Adjust the stethoscope before wearing it and place it on the artery. Be sure that you can hear the sounds of the blood flowing. Since the patient has no BP history record, start pumping until the arrow reaches 180 millimeters of mercury. In this point, you cannot hear the pulse. Once it reaches the desired millimeters of mercury, slowly release the valve until the arrow moves 3 to 5 millimeters of mercury away from the standard point. Listen carefully until you hear the sound again and remember what the number the arrow landed. Then, wait until you cannot hear the sound and remember the number where the arrow landed again. The sound started at 110. Sound stopped at 75. After that, release the valve and wait for 1 to 2 minutes to make further determination.
Remove the cuff from the client's arm and inform the client about the findings and what does it mean. Okay, ma'am. So your blood pressure is 110/75 millimeters of mercury. It means you have a normal blood pressure, so you don't need to worry. Thank you, ma'am, and take care. Thank you. After the client bid goodbye, dispose contaminated articles according to sanitation code, clean and put back the equipment to the storage, perform hand washing, and document the findings.